I'm over 18 and I consent to this video.
May I come in?
Yes.
Hi there, my name is Marissa. I'm going to be your nurse today. We're going to go ahead and do a full head-to-toe assessment. Is that going to be okay for you?
Yeah.
Okay, it's going to take about 15 to 20 minutes, so we'll go ahead and get started unless there's anything else I can get you right now.
Nope.
Okay, so can you verify your first and last name for me, please?
Brandon Wisniewski,
And your date of birth.
August 23rd.
Okay, and Brandon, do you have any allergies to any food, medications, anything in the environment, or any latex?
No.
No? And then could you just tell me, are you having any pain right now on a scale of 0 to 10? How would you rate your pain, 0 being no pain at all, 10 being the worst pain you've ever experienced?
0.
Okay, so no pain. So we're going to go ahead and get started with the general appearance. So I see that he's sitting up and he's sitting erect, relaxed with his arms at his side. He's making eye contact with me. His facial features are appropriate for the situation. He is dressed appropriately for the weather outside, and his speech is clear and articulate. I'm going to go ahead and assess his level of consciousness, so he already verified who he is. Brandon, do you know where you're at right now?
Yes.
Where?
Doctor's office.
Do you know what time it is approximately?
10:30.
10:30, and then do you know why you're here?
For a head-to-toe assessment.
Okay, so he's alert and oriented ×4. So then next we would move into vital signs. We're not going to complete all of them, but I would take his oral temperature. Normal would be 98.6 degrees Fahrenheit. His blood pressure would be 117/72, and his pulse ox would be 99% on room air, and respirations and heart rate will do in the assessment. So we're going to move into skin and nails. So first, just assessing his skin. I see that it's an even color. It's appropriate for his stated ethnic background. There are no rashes, no lesions. I don't see any breakdown on any of the skin at all. So I'm going to look at his nails next. So go ahead and put your nails out. They look flat. The color is pink. There doesn't look like there's any clubbing. I'm going to assess his capillary refill. So I'm just going to do a little pinch here and here. And the capillary refill is less than 3 seconds. So now I'm going to go ahead and touch the back with the back of my hand on the skin to feel the temperature. And it's warm and dry. And then I'm just going to do a little pinch up here. And it's assessing for his skin turgor, so it's elastic and there is no tenting. So now we're going to move on to the head and the face. So I'm going to start by just inspecting his scalp, his hair, and the skull. So just looking at it, there's no bumps that I feel, no masses, no lesions. The scalp is midline. It doesn't look like there's any infestation. The hair is thick and distributed evenly. And then looking at his face, there is no drooping. His facial features look like they're symmetrical. There's no random movements to them. So I'm going to have you puff out your cheeks for me like this. And can you smile, frown, and can you raise and lower your eyebrows? Beautiful. So next I'm going to go ahead and palpate some lymph nodes. So we have the post-auricle, the pre-auricle, the occipital, submental, submandibular, and the jugulo-digastric. So next I'm going to look at his neck. So I see that his neck is symmetrical and his trachea is midline. I don't feel any kind of masses at all. I'm going to assess range of motion. Can you look to the side for me? The other side, look up and look down. Good. And then I'm going to have you, I'm going to push down on your shoulders. You want to just go ahead and shrug them against my push. And that's assessing for cranial nerve 11, which is your spinal accessory nerve, so that is intact. I'm going to palpate more lymph nodes here. So we have the superficial, we have deep, the posterior, and then the supraclavicular. I'm going to go ahead and inspect eyes now, so I'm just going to take off glasses. So looking on the outside, I see that there's no redness, no swelling. There doesn't appear to be any infestation in his eyebrows, the eyelashes, or the eyelids at all. I'm going to go ahead and look on the conjunctiva and the sclera. So I'm going to pull down. So on the inside, there's no redness, swelling, drainage. His conjunctiva looks pink, and the sclera looks white in both eyes. I'm going to test Perla now, so just look right at me. I'm going to shine a light into both eyes, just don't look directly at it. And then follow my pen light with your eyes. Good. And then go ahead and follow pen light again. so the first test was Perla, so his pupils are equal round, they react to light, and they accommodate. And the second was the 6 cardinal points of gaze, so that's assessing his 3rd, 4th, and 6th cranial nerve, the oculomotor, the trochlear, and the abducens, and they're all intact. I'm going to go ahead now and move on to his ears. So I'm looking at the outside of them. They look like they're symmetrical and they're even in proportion. There's no lesions on the outside of them. I don't see any drainage coming out of them at all either. Looking at the back, there is no skin breakdown on either side. I'm going to look inside, and there's no infestation or anything like that present, no redness or swelling. I'm going to palpate the tragus. Can you tell me if you feel any pain here?
No.
Here?
No.
No? Okay, I'm going to do the whisper test. So we're going to assess your cranial nerve 8, which is the auditory. So go ahead and cover one ear. I'm going to whisper something in this ear. You just repeat what I'm going to say to you.
Pizza.
And then cover the other. And same thing.
Pasta.
Good. Okay, so his cranial nerve 8 is intact as well. So now we're going to move on to nose. So looking at the nose, it looks midline, it looks symmetrical. Again, no lesions or bumps or anything on the outside of it. Looking inside, I don't see any foreign bodies. There's no signs of a deviated septum, and there's no drainage coming out. So we're going to assess the bilateral patency. So just cover one nostril and breathe in for me. And then cover the other. Good. So he's got patency in both of his nostrils. I'm going to have you close your eyes. We're going to assess cranial nerve 1, which is your olfactory cranial nerve. I'm going to put something in front of your nose. Just tell me what you're smelling.
Hand sanitizer.
Good. So cranial nerve 1 is intact. We're going to now move on then to your mouth and your throat. So first I'm just going to look at lips. They look pink and moist with no cracking. They're not dry. So go ahead and smile. Show teeth. So teeth are white and straight, gums are pink, they don't look swollen, there's no signs of any cavities at all. Go ahead and just open your mouth now. So looking at the tongue, the inside of the cheeks, and the palates, they all look pink and moist. There are no cuts on the inside or any bumps that look unusual. And then can you go ah? And I see that the uvula rises and falls midline on phonation, and that's assessing his 9th cranial nerve, which is the glossopharyngeal nerve. I'm going to have you just swallow for me. Good. And doing the swallow test, normally you would do a gag reflex, but we don't have like a popsicle stick, and that's the vagus nerve or the 10th cranial nerve. And then I want you to go ahead and stick out your tongue and move it side to side. And he does that no problem, so that's assessing his 12th cranial nerve, which is the hypoglossal cranial nerve. Now we're going to look at the respiratory system. We're going to look at the front first. So first we're just inspecting it. He looks like he's breathing unlabored respirations, and he's not using any accessory muscles at all to do that. So I'm just going to palpate the front first, feel for any masses. Do you feel any pain while I do this?
Nope.
No pain. So now I'm going to go ahead and listen to the anterior lungs in 6 spots. I'm going to place my stethoscope on your chest each time I do. Just take a deep breath in through your nose, out through your mouth. Again. 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 And again. So clear lung sounds bilaterally in all lung fields in the anterior spot. We're going to move on to the back of the respiratory now, the posterior. So again, I'm just going to inspect. I don't see any signs of scoliosis, lordosis, kyphosis. He doesn't look like he's in any kind of respiratory distress either. So I'm just going to assess the AP diameter versus his transverse diameter, and it's 2 to 1. And now I'm going to go ahead and palpate his back posterior for tactile fremitus. So I'm going to place my hands on your back. You say 99.
99.
Again.
99.
Again.
99.
Again.
99.
One more time.
99.
Okay, so there's no tactile fremitus present. And then we're going to listen to the 6 lung sounds on the back. So again, same thing, just deep breath in through your nose, out through your mouth. Again. 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 And again. Okay, and then the posterior lung sounds are clear in all 6 bases as well with no adventitious sounds. So we'll move on to cardiovascular system then. I'm going to assess for any jugular vein distension or JVD, so just tilt your head back slightly and look to your right and look to your left. Good. And then I'm just looking at the carotid arteries. There looks like there's no obvious bounding pulsations or anything like that, so I'm just going to listen for bruit first in the carotid artery. So go ahead, take a deep breath in and hold it for me. And there's no bruit present, so now I'm just going to palpate the carotid artery one at a time. And the carotid artery is 2+ bilaterally with moderate strength. Now I'm going to go ahead and inspect just the anterior of his chest where his heart lays. It looks like it's symmetrical, and then again, no masses that are sticking out. So I'm going to go ahead and auscultate the 5 sounds of the heart. So if you could just sit up for me, please. Okay, so first we have the the aortic. Hold on. Aortic. We have the pulmonic. We have Erb's point. Tricuspid. And then the mitral, or the apex of the heart, is at the 5th intercostal space at the left mid-clavicular line. So I'm going to go ahead and just listen for 1 minute to get his heart rate as well as his respirations at the same time. So just breathe normally. So heart rate is at 88, respirations are at 17, so those are in normal limits, and the heart sounds I heard S1 and S2 in all spaces with no extra sounds, no murmurs, and no pericardial rubs. I'm going to go ahead and assess your radial pulses, so you can go ahead and just put your arms out like that. And I feel that those are 2+ bilaterally with moderate strength. We'll go ahead and now move on to the gastrointestinal system, so you can go ahead and lean back. So first we would just look at the abdomen itself. So just inspecting it, it looks flat to round with no pulsations. There are no lesions. Next we're going to go ahead and assess. First I'm going to assess the abdominal aorta. Okay, I don't hear any bruits with the abdominal aorta, so I'm going to assess the 4 quadrants of the abdomen for vowel sounds. So first the right lower, the right upper, the left upper, and the left lower. And vowel sounds are present in all 4 quadrants. Now I'm going to go ahead and palpate in the 4 quadrants. So you just tell me if you feel any tenderness or any pain while I do that, okay? You feel pain here?
No.
Pain here?
No.
Here?
No.
What about here?
No.
Okay, Okay, so there's no tenderness, there's no muscle rigidity. He doesn't seem to be muscle guarding either. So you can go ahead and sit up now. We'll move on to the musculoskeletal system. So I'm going to test range of motion in his arms and legs first. So go ahead and put out your arms straight for me to the sides. And if you could put them back for me, good. And then your legs, just go ahead and lift them up and put them down. So he does have full range of motion for his arms and his legs and all his extremities. So also just looking at his extremities, I see that they're symmetrical. There's not one that's shorter than the other. They're all even. Again, we're going to talk about skin. So it was warm, it was dry. There's no obvious lesions or rashes. And the skin pigmentation, the color characteristics all look appropriate for your ethnic background. So now I'm going to go ahead and test the muscle strength. So go ahead and just hold up your arms like this for me. I'm going to pull up towards me. I want you to pull towards yourself. Good. Now I'm going to push towards you. Do you just push towards me? And then I'm going to do the same things with legs. So go ahead and pull towards yourself with your legs. And push towards me. Good. And if you could just go ahead and squeeze my hands. Good. So he's got 5+ strength in all of his extremities bilaterally. And now I'm going to go ahead and palpate his pedal pulses on the top of his foot. And pedal pulses are 2+ bilaterally with moderate strength. So now we're going to go ahead and move on to the neurologic system. So I'm going to assess his sensory using a cotton ball. I want you to go ahead and close your eyes. With the cotton ball, I'm going to touch a certain area on your body. You just tell me where I'm touching. Just keep your eyes closed, okay?
Mm-hmm. Forehead.
Mm-hmm.
Cheek. Chin. Nose. Arm. Leg. Arm. Leg.
Okay, so his sensory skills are intact. We're going to assess his motor skills. So when he walked in, I did see that his gait was smooth and steady. He wasn't using any assistive devices like a walker, a cane, or a wheelchair. So he moves on his own. I'm going to have you stand up, and we're going to do a Romberg's test. So I'm going to have you stand with your feet together and your arms at your sides. Close your eyes, and for 10 seconds, I just want you to stand there. I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So he had no swaying, so that's a negative Romberg's test. If he was swaying or if he fell, it would be positive. Then next, we're going to do the rapid alternating movements. So I'm going to have you touch your nose with your finger and touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger, nose, touch my finger, touch your nose, touch my finger. And that's intact, so he's doing it appropriately and touching my finger at the same pace. And that kind of wraps it up. So we're going to just reassess pain. Are you having any pain right now? Again, on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt.
0.
0, okay. Is there anything else that I can get for you at the moment?
Nope.
Okay, so then I have your call light right here within your reach, and thank you so much for letting me do your head-to-toe assessment.